I'm Dr. Lisa Goins, nurse practitioner with Couture Healthcare. And one of the things that I tell my patients a lot about is nasal irrigation. Now, there's a couple ways to do this. One is you actually use a neti pot, or you can use an actual bottle, or you can use a little baby bulb syringe. Now, the concept is you're going to irrigate saline water, which is salt water, up your nose. Now, first of all, you got to get over the concept of actually going up your nose and doing that, so that kind of freaks people out. The second thing is if you use too much salt, you're going to feel like you're in the ocean. If that happens, you're going to need to put cold water behind it to rinse it out, because it's going to burn and you're going to cry. All right, so you don't want to do that. So basically, what you're going to do is take the bottle. You'll put some salt water in this, and these when you come in the box, they come in the box. They'll come with little packets, and there's other products you can buy over the market that's already pre-done. But if you're a DIY person and you're trying to watch your pennies, this is a quick way to do it. So you take a container, put a little bit of salt, like a tiny bit of a teaspoon in here with the water, just so that you can taste the salt, but it's not burning, okay? And it's adjustable to each person. Some people can handle a little bit more, some people prefer a little bit less. Also, the water, make sure you're not using pond water or well water. Boil it if you need to. We don't want to put any amoebas in the water up your nose, because then it becomes a party and you end up on the news. So you don't want to do that. So what you're going to do is lean over a sink. First and very important thing, otherwise it's going to run down your clothes. And then you're going to take your finger like this, and you're going to squirt it up this way over the sink. And then you're going to do the other one, okay? Now here's the catch to all of this. You have turbinates up here, up in your nose. They get swollen. So you talk like this because you can't talk through your nose because you're all congested, all right? So when you squirt the water up on one side, the water should come back down the other side. If it does that, that means these turbinates are swollen. If you squirt it and it comes out the other side, then that means these turbinates up here are not swollen. That means the congestion is not up here in your nasal areas. Now, here's the nice thing about salt water. We don't have any sea monsters that we know of. Those were all pranks and jokes that sailors did years ago to keep people from going out and finding out things that they knew, like New World, New Planets, oranges, gold, stuff like that, and bringing it back. And, it was like their swag. You don't want anybody on their turf. So, monsters and germs don't grow in seawater, or at least supposedly not. A sci-fi channel might tell you otherwise. But the cool thing about it is those germs and things, you're going to flush those out. So if you feel like you're going to work and a lot of people are sick at work, or you work in a hospital or facility, or you're going to the family gathering and everybody's sick, and you guys all have the same DNA, you're going to go to the reunion and one person's sick, everybody's going to get sick, all the same DNA strand. The germ is not going to mutate against that. Then you want to do some nasal irrigation when you get home or before you go. So you can do a little salt water up the nose on each side, and then if it's too much, rinse it out, of course. And then within about 20 minutes, you're going to go like that, and you get all this stuff, and then it's going to go, ugh, and that's all going to come out of there, and then you're going to notice that you're okay, all right? And then you'll be like, oh, I can breathe, and this is great. So that's the concept behind the irrigation with the salt waters. The neti pots, the bottles, you can use baby bulb syringes. No one recommend on using on infants. You can just use punch in the bulb syringe and stick it in their nose and pull out the snot for them. That would be the safe thing for them. And always make sure that you're using sterile water. Don't be using well water or anything like that. You'll end up on the news with amoeba growing in your head or something. So those things do happen, unfortunately. So if you have any questions about nasal irrigation, call me, Couture Healthcare. I'm Dr. Lisa Goins, nurse practitioner. Thank you.